Thank you, Mayor Harris, and good afternoon, everyone. I'll give a few data updates and then talk specifically about the areas that we'll continue to focus on as a health department. Then I'll turn it over to Dr. Randolph for some additional comments around the health directive and public health guidance. As of this morning, we have 31,462 cases. That's an increase of just 71 from yesterday. Unfortunately, we've had 457 deaths, which is 1.5% of the population. That's remained steady. It'll go between 1.4 and 1.5%. Our median age, which means the age at which half of the cases are above or below that age, so the median age of death is 73. It's really important to point that out because I think there's a perception that just the elderly are impacted, but we have had deaths ranging from as young as 13 to as old as 100. So we do know that COVID can still impact the younger population, particularly those with chronic illnesses. So it's important to consider that. Our overall trends are in a positive direction. I think that's really important. We were all concerned about the possibility of increases post-Labor Day, and we did see a slight increase, but that is really trended back down. So we know that our 14-day trend is on a downward trend. We know that our average number of new cases per day over the past week is about 128, which is positive, and our reproductive rate has gone back under 1. The important thing is that we don't want to become complacent. We are in a very good place currently, but we want to continue in a positive trend, in part to assure that, one, we can all get back to work, but that children can get back to school. And it's going to be critical that we continue to move forward in a positive way so that we can get children back into the classroom and back to school. So there's some key areas that we'll focus on, and I want to highlight those and then give some additional updates. We will continue to work on communications, particularly outreach to communities that we know either are not getting tested as much as other communities or where we potentially see an increase in the number of cases or increased risk of transmission. We really have to focus very heavily right now on testing and what we call case finding in public health, but identifying those new cases of COVID and quickly getting them isolated, then identifying their contacts quickly through the contact tracing process and getting those individuals quarantined as quickly as possible. That's a containment strategy that we've used throughout, but our numbers are small enough now that if we move very quickly on containment, we can reduce transmission, and that's going to be critical. But the other area that we need to focus heavily is on enforcement. We do know over this past weekend, we received a total of 9 complaints on facilities that were not adherent to the health directive, and the things that were reported to us were not masking or insufficient masking, not social distancing, as well as staying open beyond the 10 o'clock hour, which is when restaurants, both full service and limited services restaurants, are expected to close. And we know that some of those are staying open. Of those 9, 2 were facilities that we previously received reports on, and one of those I've actually received multiple reports. So it's really important that the public report to us when there are facilities that are non-compliant so that we can focus very specifically on those facilities and not more broadly on similar facilities. And then also we're asking particularly those who are restaurant owners or limited service restaurant owners that you review the health directive and comply with the directive, or if you have questions, please feel free to reach out to us and we'll provide education and technical assistance. Unfortunately, we will have to move to a place that if there's ongoing non-compliance that we would have to close the facility or work closely with the ABC board to potentially have a liquor license revoked. So it's critical. We want people to do well economically, but that can happen and still have compliance with the health directive. Some questions that we've been receiving recently. So there's been a lot in the national news about the test kits that will be issued to each state. We do anticipate that Tennessee will receive a shipment of test kits. The Tennessee Department of Health then will divide those kits up across the state and allow us to use those test kits, particularly for getting children back to school. So while many people want answers, we really have to await for the total number of test kits that will come into the state, look at how they'll be distributed, and then how do we strategically deploy those to assure that we can get children back to school as quickly as possible. So I'm going to pause there and turn it over to Dr. Randolph, and then we'll open it up for questions.